Hi, and thanks for inviting me to speak here. I'm going to speak to something that perhaps hasn't been raised much in the campaign, and that is that the 8th Amendment, by design or not by design, affects every single pregnancy in Ireland. So that's not just the people who find themselves pregnant and don't want to be pregnant, but that's also the people who find themselves pregnant and do want to be pregnant. So whilst the 8th Amendment, as has been so eloquently described already, was really put in place to stop termination of pregnancy, it now, the way that it's used and the way that it's referred to, is affecting everybody who becomes pregnant. It affects you because you effectively become a vessel, if you like. You become, your body and what's growing inside your body becomes controlled by the state and no longer controlled by you. So that means that any choices you wish to make, including terminating your pregnancy, is now controlled by the state and not by you as an individual. So that continues all the way through until your baby is either miscarried, you have an ectopic pregnancy, you travel abroad or take an abortion pill in Ireland, or you give birth to your baby. At that point, you reclaim your body as a woman, and you reclaim your personal autonomy, and you once again are able to consensually decline or accept care in the same way as any other person. So when you think about every pregnancy, how many people does that affect? That affects much more than what we tend to talk about. We tend to talk about what figures we have, and they are not accurate. They're estimates of the number of women that give an Irish address in the UK, of the number of women who've travelled to the Netherlands, of the number of women who take an abortion pill in Ireland. That's several thousand per year. But when we think of the number of people who become pregnant, who fall pregnant, that's close to something like 100,000 pregnant people and women a year. So that's magnified. And all of those people will be affected by the 8th Amendment. So, for example, if you really want to have a baby and you've gone through IVF, and this is, perhaps your penultimate chance, and you then go in to your obstetrician, your doctor, and you want to know, did this round of IVF work? And you're told, well, it's 6 weeks and 4 days, we can pretty much say that there is an embryo implanted and things look good. And you come back next week because you've had several miscarriages already, and now you're told that it isn't 7 weeks and 3 days. Your embryo still looks like 6 weeks and 4 days. But all might not be lost. We know that all embryos grow in a certain way, so we have a signature for them. We can match whether an embryo is growing properly or not. You come back the next week and your embryo should now be showing 8 weeks gestation, but it still shows 6 weeks and 4 days. But there is a heartbeat. So you will be told now to come back repeatedly until that heartbeat naturally stops. You will be told that your embryo is not viable, that this will not become a baby for you, this will not be what you were hoping for. But you cannot go and try again. You have to wait now until that heartbeat that will never go anywhere can stop. And this might take 11 weeks, it may even take 12 weeks, and this is absolutely heartbreaking for women who want to leave that part of their grieving and move on. And if you don't want to do that, if you do want to wait until the heartbeat stops naturally, that's fine, because you're able to do that. But many women don't want to do that. They want to move on, and part of their grieving is to move on. So that's something that's not often talked about. If at any point during your pregnancy your health becomes endangered by your pregnancy. Pregnancy is a funny thing. It does different things to different women's bodies, things that we never expected it might have done when we're not pregnant. People often talk about women becoming very hormonal. That's sort of the least of the issues. But a lot of physical things can happen to you. Your circulatory system changes. Lots of things change in your body. And you may find now that your health, because of your pregnancy, falls into danger. And what happens then? Do you have the option of saying, well, you know what, I really wanted this baby, but I actually want my health. I matter more than having this baby. I have 2 other children at home. I don't want to die in pregnancy, I do want to continue it, but I also want to be there for my other children. That's a very difficult choice to make, but that's a choice you're not allowed to make in Ireland under the 8th Amendment. You have no choice but to continue the pregnancy. That is the only choice that any person who becomes pregnant in Ireland has legally. The only choice you have is to continue. So what if your pregnancy now makes you susceptible to brain bleeds? What happens then? When you're having a brain bleed, yes, it's potential that there is potential for your life to be in danger, but when you're not having a brain bleed, that's merely your health in danger. And how long does it take from your health being in danger to your life being in danger if you have this susceptibility now? Maybe 5 minutes, maybe 10 minutes. So if you're wandering around Dublin doing shopping, you're not really going to be able to be saved. And that was a situation that someone wrote to us about, and that blog is on our website and you can find it. And it's called My Life Matters if you want to read more about that. And that was someone who desperately wanted a pregnancy because she had had so many miscarriages. And she was tortured emotionally from about 21, 22 weeks onwards. She had to continue a pregnancy and she thought that she was going to die at any point and that she wasn't going to be saved because the time lapse was too short. And she had other children at home. And when she gave birth to her baby, she asked for her tubes to be tied so that she would never have to endure that during a pregnancy ever again. And this is someone who wanted to be pregnant. So these things happen all the way through pregnancy. When you come to the end of pregnancy, you think that, well, okay, by the time we get to viability, we're done with that. But no, you're not done with that. Because when we come towards the end of pregnancy, you have the birth itself. And obviously women are autonomous agents and they want to make certain decisions about their birth. They want to perhaps accept certain interventions and decline others. You don't have that option in Ireland. We have a national consent policy that specifically cites the 8th Amendment. So in any other aspect of healthcare in Ireland, you as an autonomous individual gets to choose whether you would like to have treatment or not. And sometimes in medicine, people actively decline life-saving treatment. They don't want to have that treatment, and that is their choice. That is their autonomous choice. You don't have that choice. I mean, I've never met a woman who declines life-saving treatment in pregnancy because she wants to live and she wants to have her baby. But you don't have those choices around interventions. You don't have those choices around issues associated with childbirth. In particular, you don't have those choices associated with induction. So exactly when your baby is due, it's not a science. It's due any time between 37 and 42 weeks. Any time between 37 and 42 weeks is viable, is fine, is considered full-term pregnancy. So what if your healthcare provider decides that you can't be pregnant any more than 40 weeks? 40 weeks and 2 days, 40 weeks and 5 days, 40 weeks and 8 days, 40 weeks and 10 days, 12 days, or 14 days. And there are healthcare providers, for example, in any of the maternity hospitals here, within the same hospital, that would have different beliefs about how long a pregnancy should go on. And the woman may have her own beliefs about how long the pregnancy should go on. And if your opinion would differ from your medical team, you don't have an option to refuse that. And there have been cases where women have been taken to the High Court. There was a Mother A case, and then, as you say, there's an alphabet of it. And then there was a Miss B case, and both of those women, there was a dispute about how they would give birth to their babies. And both of those women, it was proposed that they would be sedated. And in one of the women's cases, the solicitor recently revealed some of the information, and the HSE actually applied for that woman to be forcibly held down, and that people who are trained in the capacity of forcing people down would be part of her care team, and that they also applied to the Gardaí that the Gardaí would stop her leaving the hospital should she try to, I mean, it's like something out of 1984, and these are all facts. They are all there in the law library. And both of these women had visits to the High Court at the very end of pregnancy, and those visits were enabled by the 8th Amendment. So this isn't something that is just associated with abortion. It's something that goes all the way through. Now, thankfully, those visits are very few. But if you are pregnant and you hear about them, they're worrisome, and it does make you concerned, and it adds an extra anxiety that pregnant women and pregnant people don't need at the end of pregnancy. It's anxious. it's anxious provoking enough, you know, that you're thinking, I've got to give birth, and how will it be, and will everything be okay? You don't need any extra items of anxiety. So if we were to have a yes vote, then it would mean various things for all of those situations. We would have the 3 to 5 women that are taking illegally imported medication and taking it in an unregulated fashion here, those women that Mark spoke about, they would now be able to take that medication in a regulated way, supported by their healthcare provider and in partnership with their healthcare provider. The 9 to 10 to 12 women who travel every day, and there have been probably 9 to 12 women that took a plane or boarded the boat today, most of them would be able to access abortion care in Ireland. Some of them won't, because they will have passed the 12-week barrier. But most of them will. We know that the majority of women from Ireland who seek abortion in the UK do so before 12 weeks. So we're not talking about later term abortions here. We've heard a lot about people with disabilities being brought into the argument, and certain types of screenings would be carried out, and people would automatically have the ability to access abortion for certain types of eugenics that they didn't want in their lives. Well, that's also not true, because if we take the very common situation that often older women get screened for, and that is Down syndrome, that screening is available here, but not until 10 weeks. The results of that screening test have to go to America, and they have to come back. When they come back, if they come back showing an indication towards a positive, they then have to be formally diagnosed, which means a second round of diagnostics rather than screening. Now we're talking perhaps about CVS, and again, those results have to go to labs outside of the country. You've got your 72 hours cooling off period. That isn't going to happen here. You know, though there's been a lot of scaremongering in that area. The idea of babies being aborted at 6 months, that's also completely ridiculous. The legislation will provide for women who have been diagnosed with fatal fetal anomalies, and that means that they will only know those when they have a proper scan at about 20 weeks. So that is going to be beyond 12 weeks. But those people, their babies will be, their pregnancies will be brought to an end, and those babies will be born, and they will not be able to survive because they're not viable. If, on the other hand, there is a situation where a woman's life and her health now is in serious danger, and the pregnancy has to be brought to an end, then any baby that is delivered and is viable will be cared for in the neonatal unit in exactly the same way as all premature babies are cared for in Ireland. And so this notion that we're going to be enabling late-term abortions here is completely fraudulent and completely ridiculous. And I think that another issue that needs perhaps some clarification, and Mark might say more about it afterwards, is the fact that gestational age and the number of weeks you are pregnant are not the same thing. So, for example, if anybody's watching this and you're a woman and you're still fertile, if you had a period and you had that period 4 weeks ago, you would be considered 4 weeks pregnant now. But you actually haven't got anything growing inside you. So, or maybe you have, but the point is that your pregnancy is dated from your last menstrual period. So you always have the extra 2 weeks added on. And that assumes a normal cycle of 28 days. Many women don't even find out that they're pregnant until the second missed cycle. They might assume that the first one, they might have some bleeding, they might have implantation bleeding, they might think, oh, well, that was my period. And now suddenly they're 8 weeks pregnant when they find out that they are actually pregnant. But the fetus that's growing inside them is not 8 weeks. The fetus that's growing inside them may be 6 or 5 weeks if they have long cycles. And it's important to make that point, because often you will meet people, if you canvass, who have issues with 12 weeks. And it's important to make that point, that often you're really dealing with 9 weeks in terms of gestational age. I don't want to speak for too much for too much longer, but Mark has so eloquently outlined the harm that the 8th Amendment has done, and that it's kind of a continuity of the harm that our society has consistently and repeatedly done to women, aided and abetted by the Catholic Church, and it's time to let that go. For me, I think that the referendum, it's the greatest test of Ireland as a modern nation. You know, we're either there or we're not there. You know, are we a modern secular society that will give human rights and choice and a safe maternity service to all women, or are we not? And I really, really hope that we are, and I really hope that the referendum is passed and the 8th Amendment is removed from the Constitution.